In this video, we will outline the recovery from surgery if you are having a decompression and fusion of the lumbar spine. The length of recovery is generally dependent on many factors. However, the two most important factors are the age and the complexity of the surgical procedure. As an example, it may take you around 6 weeks to recover from a single-level surgery if you are 30 or 40 years of age. Following this general guideline, in a patient who is over 70 years of age and having a multi-level surgery, the full recovery may take up to 6 months. This is of course only a guideline, which is often fast-tracked by patients who are very motivated, fit, and are able to perform their physiotherapy and exercise regime with vigor and enthusiasm. On the day of your surgery, after being woken up from the anesthetic, you will be assessed for the need of intensive care. If ICU is not required, you'll be transferred to the ward. The first afternoon is generally spent in bed until the next morning, when you will be assisted to sit out of bed or walk if you are able to. I usually do not impose any restrictions to the amount of sitting out of bed or walking any patient can do from the first day, unless there is a medical reason to do so. Within the 5-day period after the operation, you will undertake frequent walks around the ward with the assistance of the nursing staff and physiotherapists. This is primarily aimed at regaining your independence. Prior to discharge, whether it's home or to the rehabilitation hospital, you should be self-caring, which means able to dress yourself, feed yourself and wash yourself. If your capacity does not allow this in the first few days, this will be attended to after discharge to the inpatient rehabilitation centre. Around the day 10 after surgery, you will see your local doctor to review your wound, which does not need any stitches removed. Your pain relief regime will also be reviewed, commencing the sliding scale weaning off of the opiates within the next 6 weeks. You'll see us in the rooms at the 6-week mark to discuss the surgery, correlate the short-term outcomes to the surgical plan, and further outline your recovery over the next few weeks. In terms of your pain after surgery, as your leg pain would have completely resolved as a result of the surgical intervention, as most of the back pain present prior to surgery had also eased dramatically, the majority of pain you will experience for the first few weeks is the surgical back pain due to muscle spasms. This is relieved very effectively by alternating periods of rest, frequent walks, upright activity, and pain medications that will be managed as required. Within the 6-week period after the operation, you will continue to build strength, further manage the muscular back discomfort due to spasms, and gradually take up more intense physiotherapy regime, including hydrotherapy. At the end of the 6 weeks, even though with some difficulties, you should be able to do majority of things you want to do, including lifting and driving. Over the next 3 months, also with the aid of physiotherapy and frequent walks, you will build your resistance to more strenuous exercise with no restrictions and gradual return to normal, pain-free activity. Over the period of next 3 to 6 months, should you wish so, you will be able to engage in high strain or impact activity, including sport. Assuming that by then the bone graft has solidified and fused, the metalware does become superfluous without the need of removal. At that point, there will be no restrictions placed on your activities of leisure or work whatsoever, and the primary objective will be to build endurance with the appropriate strength in your core muscles. Your final review by me and my team in the rooms is generally scheduled for the 12-month mark. However, you are very welcome and encouraged to continue seeing us as you wish in the future. The last review of your outcome and improvement via a questionnaire sent out by the Spinal Registry happens at the 2-year mark. Moving forward, you'll be encouraged to lead a healthy lifestyle in terms of diet and exercise, always adhere to safe lifting, carry out work practices and leisure activities which are instrumental to good spinal health. Even though you would have heard these points prior to seeing this video, I do encourage you to call us if you need further clarification or if you have any other questions related to your surgery and recovery.